Good evening. Thank you so much for joining. This is an AONM webinar, another in the series that we're holding regularly now, and this time it's about food hypersensitivity testing and the overall topic. I'll be holding this one myself. I'm a naturopath and nutritional therapist and have had a senior position at the Academy for Nutritional Medicine for many years, since 2010, I think. And I've actually known of and been using the testing system that we'll be talking about today since 2004. I was in Germany at that time and studying the mitochondria and came across it and was very impressed by it. And we've been using it at the Academy of Nutritional Medicine for around 10 years now, but it has just changed slightly, which I'll be explaining, into a test called ImuPro. It is the same laboratory and we have a very good relationship with them and have worked with them for many years. So I'll move over now to the presentation. I'll be talking for about 45 minutes, maybe a bit less, and then we'll have time for questions. Please pop them into the chat or the Q&A. And so I'll move over to the presentation. Oh dear, where is it? Here we are. Yeah. So the presentation is called IgG Food Hypersensitivity and the ImuPro Dietary Concept. And I'll be covering a number of different topics. I'll try and speak louder. Last time, a couple of people said I hadn't spoken loudly enough, and so I will try, but please do put into the chat if it's still not sufficiently loud. So the topics I'll be covering are immune versus non-immune mediated food hypersensitivity, the evidence base for IgG food testing, the ImuPro test itself, and various aspects of it, including the ImuPro strategy that's suggested. So to first of all look at the different types of food-mediated reactions, there are the non-immune and the immune-mediated ones primarily, though of course there are, as you'll see at the top of the chart, toxic reactions as well. We're not talking about poisoning directly. And the non-immune-mediated reactions, on the one hand, are pharmacological, enzymatic, irritants, or psychosomatic, and the immune-mediated ones consist primarily of IgE and non-IgE mediated hypersensitivity. So when we're talking about the non-immune mediated food hypersensitivity, lactose intolerance is one of those, and food additive reactions and lack of psychological tolerance, as just mentioned. I will just mention as a side note that we do now also have a lactose intolerance test that can be done as a finger prick. So perhaps by the end you'll also feel that that would be something useful to look into. The immune-mediated food hypersensitivity, IgE food allergy, is one I'm sure you'll be familiar with, that carries the risk of anaphylaxis, hives, swelling of the mouth, lips, or throat. It is very dangerous, and once you know that you have an IgE food allergy, you should keep that in mind, and whether you have an IgG hypersensitivity or not to that food, that has no relation to the IgE one. So that's one that you always need to take into consideration when you're looking at foods to consume. Around 3% of the UK population have IgE mediated food allergies, according to the NHS, and these reactions can be life-threatening. So it's really, really important to separate out the two. Those are, familiar allergies are peanuts or pecan nuts or fish and shellfish, but there can be many more as well. So another immune-mediated disorder is celiac disease. You can see in the upper picture here how the villi should normally protrude into the intestinal lumen for absorbing nutrients. And if you have celiac disease, then areas of the intestine may lack these villi. It doesn't need to be the entire intestine, of course. And you can see the flat lesions along here. And then you do need to very, very strictly avoid sources of gluten. And this can be identified by looking at your HLA haplotype, DQ2 and DQ8. But there are various tests that are used for that. And that will mean avoiding gluten for life. Immunoglobulin G, which is what we're primarily going to talk about today, is one of the most common or abundant proteins in human serum. It makes up about 10 to 20% of plasma protein. And there are several different isotypes. And the four subclasses, IgG 1, 2, 3, and 4, are all very important. And I'll be talking a little bit more about how necessary it is that an IgG food test covers all of those subclasses and not just IgG4, which is sometimes the case. So what's the problem with these IgG food reactions? They are called type 3 hypersensitivity reactions. They're delayed reactions. They only occur between about 2 to 3 and 72 hours after eating a food. So you don't notice them immediately. And it can be very difficult to identify which food has actually triggered the reaction. Immune complexes form that trigger inflammatory reactions, and these can cause tissue damage as well. This is shown at the top of the image here, where you can see the intestinal wall being damaged by these complexes that can form, and the food components, if they slip between the intestinal cells and into the bloodstream, then trigger an immune reaction with, it's almost like an autoimmune reaction where your immunity is attempting to remove those portions of food, components of food that have slipped out in usually the wrong parts of the intestine, and they're not small enough, they're not fully digested. I'll just read a little bit of the article here down below. In type 3 hypersensitivity reactions, an abnormal immune response is mediated by the formation of antigen-antibody aggregates called immune complexes. And they can precipitate in various tissues, such as skin, joints, vessels, or glomuli, and trigger the classical complement pathway. Complement activation leads to the recruitment of inflammatory cells, which are either monocytes or neutrophils, that release enzymes and free radicals, causing tissue damage. So further ramifications of this tissue damage are that the intestinal barrier is really supposed to prevent the entry of pathogenic microorganisms into the circulation. So if it's compromised, then it can potentially allow pathogens from within the intestinal tract to access the bloodstream, and this can be a source of infection. As the second sentence here says, a regulation of the exchange of molecules between the environment and the host through the intestinal barrier influences the equilibrium between tolerance and immunity. And that kind of egress of bacteria and viruses and other lipopolysaccharides from the gut into the bloodstream shouldn't be occurring. Mitochondrial dysfunction can also be involved because inflammation inevitably means an upregulation of glycolysis, the formation of lactate, the downregulation of the mitochondria, and as it mentions here in this article, cells involved in the pro-inflammatory response must rapidly provide energy to fuel inflammation, which is essentially accomplished by glycolysis and high lactate production. So what you've got is a downregulation of the mitochondria and an upregulation of glycolysis, which, if that continues longer term, is extremely problematic, not just for your energy delivery systems, but also for the health of organs and the overall organism, which needs the oxygen from the mitochondria to power it. And this will inevitably mean less utilization of oxygen in the tissues. So what is the evidence base for IgG food testing? Well, first of all, let's look at the problems that this can cause. Primarily researched have been gastrointestinal symptoms, such as IBS and IBD, that's irritable bowel syndrome and inflammatory bowel disease, and skin-related issues, such as dermatitis, eczema, psoriasis, and chronic pain, including headaches and migraine. And of course, excess weight can be driven by the accumulation of fluids in the tissues that are dysregulated, and autoimmune conditions as well. So many of these have been well referenced. I've just got a selection of references here. There are many, many more that we could provide, and these are just for the inflammation that can be caused by immunoglobulin G hypersensitivity. The next page covers a few references relating to IBD. As I say, there are many more. The next, IBS, that's both the diarrhea, constipation, and mixed varieties. And this article talks about the value of looking at these delayed food intolerances in migraine and in IBD. This was a randomized controlled trial with 21 patients, and the findings indicated that eliminating foods based on the IgG antibodies that had come up in the test in migraine patients with IBS may effectively reduce symptoms from both disorders with a positive impact on their quality of life. The pilot study in the next, on the next page talked about migraine symptoms and quality of life. And this was 37 subjects who found that eliminating IgG-mediated reactive foods from their diet reduced their migraine symptoms and improved their quality of life. And this was a larger study, but not quite so extensive as the previous one in terms of the various different phases. The next one talks about the frequency of migraine attacks, and it was a double-blind randomized crossover trial. And this one had 30 patients in it, and it was actually the first randomized crossover trial in sufferers of migraine, showing that dietary restriction based on IgG antibodies was effective in reducing the frequency of migraine attacks. And that was published in a very excellent journal, Cephalgia. The study here relates to significant improvements in abdominal pain and diarrhea. this one had 77 patients. They were IBSD patients, in other words, suffering from diarrhea related to their irritable bowel syndrome, and 26 healthy controls. And this was a 12-week study where they experienced significant improvements in abdominal pain, diarrhea, and other markers of their distress. The following one, and I don't have huge numbers here, there are so many that one could identify from that previous list of references, but this one focuses more on body composition, and 120 subjects in this study found they were able to improve their body composition and quality of life in response to eliminating IgG reactive foods from their diet. And that's actually a well-powered study, definitely worth looking at. Thyroid markers also can respond to examining the IgG reactions you have to foods and avoiding them accordingly. This was a 6-month observational interventional study, and this showed that almost all markers, that certainly all of them that were examined, that was TSH, FT4, FT3, TPOs, and TGs, that's thyroid peroxidase antibodies to the thyroid, and thyroglobulin antibodies, all showed an improvement. In the case of TSH, that would be a reduction, and in the others, an increase, apart from the antibodies, of course, which would decrease. So again, very, very worth going through that article, because it's fascinating that it can even affect thyroid disorders. So the ImuPro test itself does cover all 4 types of IgG, and it's useful to note that the abundance of IgG is 60% for the first one, that's IgG1, and 32% for the second, immunoglobulin G2, and only 4% for the other 2, 3 and 4. I'm only mentioning that because previously, less so now, many food, as they were called, intolerance tests, really hypersensitivity tests, actually only covered IgG4, and you can see that's such a tiny fraction of the total, even though it's an important one, that it's practically inconsequential. And so the test with AONM, the ImuPro test, can be conducted either as a blood draw or a finger prick test, and there was an extensive period of comparative testing to see, and the finger prick test is just as good as the blood draw. And the costs are lower as well, because you don't need to go to a phlebotomist and send in the blood via courier to Germany. And we can go through all of this later, but the number of rings that you have to fill is also clearly specified in the kit that you receive. That can be done from home. You do need a lancet, and you need to be able to prick your own finger or have somebody to help you do it. But if you prefer to combine this perhaps with other tests that you're doing, then it doesn't need to be centrifuged. It can be sent as a tube, and a so-called serum separating tube, to Germany. And as long as it arrives there within a few days, it doesn't have to be just 1 or 2 days, then it's perfectly viable and can be used as it is. So it is not essential to have a centrifuge. Though if you do have a centrifuge, that's absolutely fine. You can send centrifuged blood, of course, as well. So the different types of tests available are varying in the number of foods that are tested, from 44 to 270. And if you'd like to do it as a vegetarian, there's a veggie test of 90 foods, and a veggie plus of 221 foods. And you can upgrade from, for example, 90 to 270 if you feel after receiving the results that you'd like to know more, include more foods. The length of the report that you receive varies depending on how many foods you've tested. It's actually up to 92 pages. So you do get a detailed report the more foods you do. And the ImuPro concept is fully explained as well. So I'll explain that. I'll talk more about that in a moment. So the testing process in the lab is that the delayed immune reactions are examined starting from 3 to 72 hours after an antigen has been consumed. And the plates all have a specific antigen in them that will check the protein from the blood and sound alarm, as it were, if there is an IgG reaction of a certain strength. And this has been checked for each food. There's a different strength for each. So the actual results that you get are in orange for a sort of moderate reaction, and red for a really high elevation. And each of the micrograms per milliliter of IgG is different per food, and that has all been very carefully tested. And the test and laboratory are actually accredited according to the highest German standards. So it's interesting that it's divided up into different food groups. That makes it very convenient to read. As you can see here, this is just one page of the large test, the 271. You've got cereals containing gluten, cereals without gluten, it's grains really, eggs of different types, meat, milk products, and it goes on to fruits, seeds and nuts, and so on. And it does also test for candida in the blood. And you can see how many different categories there are, including food additives. So the more antibodies there are in a well, the stronger the color. And this is categorized into 3 groups: green, orange, and red, with the exact level given, so that if you repeat the test, sometime later, you can actually check on whether the level has gone down, because it definitely can do. It's not that you have this for life. So one study done on this exact test with over 1,500 participants found that IgG reactivity was predominant in 8 foods. These were oats and barley and rye, cow's milk, wheat, another type of wheat called 𝐃𝐈𝐒, spelt, and gluten. And interesting, the different sizes of the circles show how, great the proportion of people in that large study were who had reactions to those particular immunoglobulin tests. This is an article. All the articles I'm referring to are referenced at the bottom of the page. And so studies have evidenced 0 physiological reaction in IgG titers after provocation with foods. So it's not correct to say that everyone has IgG reactions anyway. It takes a lot of time to go through all the literature that's accumulated over the years relating to this, but this is just one that does show that these very small bars at the bottom of the graph here show the patients before provocation and after provocation, and the lighter blue is the controls, but they have not increased in their IgG reaction after having soy, hen's eggs, and cow's milk in certain high proportions over the course of 3 weeks. And these were people who were not sensitive to these foods, and it had been checked that they were not, at least their perception was that they were not having symptoms from these particular foods. And it's not that suddenly from having a high quantity of these foods, they developed a high IgG, which is a criticism sometimes made. So, you know, that is something that one can definitely counter with various studies. So what are the exclusion criteria in this test? This is the only test, I think, worldwide that gives you the chance to include additional exclusion criteria if you wish to, so that the diet that you're being recommended excludes specific foods, even if you don't have IgG reactions to them. So it's 16 different foods listed, or food characteristics listed here, like foods with a high histamine content, or those that contain lactose, or fructose, or seafood, shellfish, citrus fruits. So you can exclude those. They do suggest only excluding 3 max to start with, because otherwise they can't put together recipes for you if, you know, too many are excluded. But you can see here in these examples that while this person here didn't have an IgG reaction to crayfish, they had requested that foods high in histamine were excluded. And then this category or column on the right shows the foods that are high in histamine that they'll probably want to exclude. And that may mean that they know they have an IgE reaction, for example, to that particular food. So that will be excluded from their rotation diet that they're given, and also from the recipes that are suggested. And the same here, where somebody had asked to have nuts excluded. And while they had a reaction to almonds on the IgG axis, they didn't have a reaction to Brazil nuts or cashews, but those were labeled up, and they know that those won't be included in the foods that are suggested later. So that's even got a category for other. So you could exclude, for example, omega-6 if you wanted to, you know, foods high in a particular fatty acid or whatever. You know, you can include one other category of food. So histamine intolerance is, of course, a major part of this that we won't be going into in great detail today, but the ImuPro testing service does also offer a histamine intolerance test, and that shows you whether you have sufficient levels of diamine oxidase, which is the enzyme that breaks down histamine, or whether they're on the low side, and that's extremely useful and can be added on to the test. So if you do choose to do that, then you get you know, quite a long section of recommendations about that too. And interestingly, inadequate histamine degradation is something that's often missed. This is from a medical article on histamine intolerance, and talks about the different kinds of issues that can trigger, from headaches to hypotension to urticaria, even asthma, after ingesting histamine-rich food, if you don't have sufficient enzyme to break it down. And of course, there are different exogenous enzymes that you can take if you find out that's the case, which really help, apart from just avoiding histamine-containing foods. And of course, there are many other medications, for example, that will suppress your levels of diamine oxidase or increase histamine release. So it's useful to get access to lists of that kind as well. This is just presenting that same information in a different perspective, really showing how that related to the heart and circulatory system, the skin. These are all potential culprits of histamine intolerance, the digestive tract, the genital tract even, and the central nervous system. So the individualized recipes are included in the tests that cover a larger number of foods, like 180 or 270. Very nice recipes that are absolutely tailored to what has come up in your testing. And this is just 4 of them out of the many that make up this long report that you get. And there is actually a source of recipes adapted exactly to the exclusion criteria that I've just mentioned, whether low histamine or lactose-free or low in a particular fatty acid, called ChilianSweet.com. And they have, as you can see here, recipes according to those specific exclusion criteria. So what is the strategy that we'd mentioned at the outset, the ImuPro strategy? The nice thing about this test is you don't just get the test and get left with it and basically need to work it out either alone or, of course, with your therapist as to how long to leave out the various foods and which and how to handle that. Of course, hopefully you will have a therapist to sort of tread that path with, but the ImuPro strategy underlies this test and it's really very helpful. It consists of 3 phases, which are elimination, and then provocation, and then stabilization. And the elimination phase covers the foods to avoid, which of course you'll have seen. They're the orange and red foods, but it only recommends eliminating them for 5 to 8 weeks, not for months or years, while going through the foods in your rotation diet once every 4 days. And this is to allow the reactions to gradually die down and for new ones not to build over time. So going through each of those phases in a bit more detail, you can see here that, and this is all both on the website to a certain extent and in the reports you receive, explained in greater detail there. So if you strictly avoid the IgG positive foods, the inflammation processes that they've triggered can be reduced or even discontinued. And this is important preparation for the next phase, which is provocation. So some important tips are, of course, as I'm sure you'll be doing, reading labels on foods to make sure that what you're hypersensitive to is not included in something else that's a mix of different ingredients, and trying to choose unprocessed foods wherever you can, avoiding additives. And if you, at the beginning of this phase, find that you have a sort of 𝐏𝐿𝐒𝐂𝐋 reaction, you feel a little bit worse rather than better in the first, say, maximum 10 days, that may be because of a detox reaction, which is well known in this field, and you need to drink plenty of fluids to help the process, and your therapist will, be able to encourage you and pass a little bit the different foods that you are leaving out. Sometimes if it is a few too many, you'll be able to make some decisions, some strategic decisions with your therapist from the beginning. But if this deterioration continues for too long, then you do definitely need to get back to your therapist. So within that elimination phase, you'll be rotating, hopefully, the foods according to a rotation scheme that is given to you. I'll just pop to the next page to show you. You are given a personalized rotation schedule that's a lot longer than this. It includes all the foods that are permitted, but suggests that you have them not every single day, because that can be it can be a trigger for further allergy. Well, I won't say allergies, for further hypersensitivity during this process if you're having the same kind of food regularly. And also it enables you to get enough minerals and vitamins from this process, especially during those first 5 to 8 weeks. a lot of people find that they're actually eating a broader range of foods rather than a narrower range in the course of this, because so many foods are suggestive that perhaps you'd never thought of eating before, that, you know, are relatively easy to access nowadays, perhaps 10 or 15 years ago not. But nowadays, you know, most of these foods can be purchased relatively easily. Of course, try and get them organic if you can. So that's the rotation. And then the provocation phase is gradually reintroducing the foods you had previously eliminated, but beginning with the orange ones. So you make it a little bit easier on yourself. They're the ones that you'd have less of an IgG reaction to. So you, for example, if it's hazelnuts you're introducing, you just introduce that one food that you were hypersensitive to on one day, a good amount of it, and not mixed with other things, for example, not a hazelnut cake, but the actual hazelnuts. And then for the next 3 days, watch for reactions, whether any of your old symptoms come back, and also whether you gain weight, particularly overnight. Check for whether you're putting on about 1 kilogram overnight, because that can be due to the accumulation of fluids. It's a kind of edema due to the different kinds of complement and histamine reactions taking place. So if you pass those 3 days without those kinds of reactions, then you can go on to the next food. And once you've gone through the orange foods, then go on to the ones to which you had the highly elevated reactions, the red foods. So that's the suggestion. That's what the provocation phase means. If you like, there is a provocation diary that you can download. You don't even have to, you know, buy the test, as it were, in order to access this diary. This is the link down here. And you can run through that process, entering the reactions that you're having into the diary. And if you have had a reaction that you do associate with the reason why you're doing this test in the first place, whether it's a migraine or your IBS is really serious, you're having your IBSD again or whatever, then you need to avoid that food for a year. And noting down the date and the date at which you'll be able to reintroduce that food for further provocation is really useful. So these practical tips explain how to go through that process. And I have got a summary of it later, so I hope it'll be clearer. But the stabilization phase is that hopefully you've discovered your trigger foods. Those are the ones that do lead to a worsening of the reactions, a reintroduction of the symptoms or weight gain that's, you know, sufficient that you really do notice it overnight. And those will be excluded while you'll be stabilizing yourself on the rotation diet that you have, that includes the orange and the red foods that you've been able to introduce safely. So this is ideally done with a therapist. You don't want to sit there doing this alone. You want to be able to discuss it as you go through it. But it's all explained here, which is very helpful, because a lot of food hypersensitivity tests don't give you guidance after receiving the initial sort of list of foods to avoid. So the summary is here. I won't go through it all in detail, but this is going to be both on the website and sent to you afterwards, so you can go through it in detail if you'd like to. Just to mention that a large-scale study was done using exactly the ImuPro test and this strategy. And I don't believe that this isn't actually the only study that's been done, but this one I have here was impressively done on a mixed IBS cohort. That means sufferers who had both diarrhea and constipation. And only the IgG elimination rotation diet could demonstrate significant improvement in all of the monitored symptoms, as well as the extra-intestinal symptoms. rotation diets based on IgG showed significantly better results compared to other diets. So that was a very, very interesting study referenced at the bottom that could well be worth looking at in greater detail. I do have cases as well, a lot that I can give you access to if you'd like. I won't go through them all now in detail. This is one that was presented at the 25th World Congress of Dermatology just recently, the 3rd to the 8th of July this year, on a child that overcame its chronic pruritus, it's called prurigo, and eczema by eliminating primarily the gluten, milk and eggs. That was a particular type of milk here, boiled milk, and chicken eggs that had come up on this test, and you can see all of the gluten-containing grains. So I know that the color of the skin here isn't particularly healthy looking, but actually it was a definite remission of the child's lesions, and the same in the second male patient, aged just 1, where management, along with other initiatives, it's not just dietary, was able to overcome his atopic dermatitis within just a few months. And the cases I have on the next couple of pages relate to dermatology as well. This was presented at the European Academy of Dermatology and Venereology just recently, 2023. Several cases there. In fact, that's a full study that we could let you see. And the same with this one here, the European Society of Pediatric Dermatology. So what I can say is that I've definitely seen huge improvements in patients using this testing, which I've been familiar with for almost 2 decades now. And it has, at the beginning anyway, primarily been German-speaking therapists from Switzerland, Austria, and Germany who used it. It was a large group of about 5,000 who we were working with, and now over several of the years, it's become much better known across the world and is being used in countries as far as Saudi Arabia and Asia and the States. There are actually representatives of this test all over the world. So that's ImuPro testing. Please go to our webpage. It's AONM.org, and the food sensitivity tab gives you further information on it. And the next month, it's a bit more than a month really, we'll be offering 10% off all ImuPro tests. So please do have a look at that. And there are many different benefits of this compared to other food sensitivity tests that I haven't highlighted hugely over the course of the last 45 minutes, but they are outlined on the page. And I think you've probably got an impression. It's the length of the test, the detail, the concept, the fact that you can exclude many different other nutritional characteristics if you need to, and then you have a full rotational diet and many recipes as well, which makes it very unusual, as well as a website that gives you access to other recipes and support from us, as well as a worldwide group of therapists and patients using this. So thank you very much indeed. That's as much as I had prepared to discuss today. There's lots more one could say about it. But let me now have a look at your questions. I'll just stop sharing so that I can go into the chat and the Q&A. So let me just open that up. It's an unusual situation. I actually must admit I haven't done this with AONM for a long time, is actually asked the questions myself. Usually I'm interviewing someone and then asking them the questions which I've had time to peruse. So Val asks, how can IgG testing help with chronic fatigue? What foods can cause inflammation seen in patients with fatigue? Any experience there? Well, I would say, just a minute, I'll just have a quick sip of water. That because of what I mentioned towards the beginning, which is that this constant inflammation ticking away suppresses mitochondrial action and increases glycolysis, which inevitably means that you have less oxygenation of your tissues. Less oxygen is getting into your body because of the lack of oxygen going into the mitochondria. You've got upregulation of glycolysis from carbohydrates, but what that means is you're not able to access your fats as well, because mitochondria primarily work on fats. And also you've got this inflammation, and lactic acid, which is the side effect of having high glycolysis, causes pain, or can do, in the cytosol where it's being formed, and that can develop into muscular pain. It's the equivalent of what runners feel after a marathon. And so depending on how the chronic fatigue or the ME is actually manifesting itself, there are many overlaps between IgG, hypersensitivity, and chronic fatigue that could be mentioned here. So you're asking what foods could cause inflammation seen in patients with fatigue. Again, that can be right across the board. I mean, the key culprits are those that we saw in that bubble diagram there. The most common ones that I see coming up are the grains, eggs, and dairy products, but it can be really unusual foods. I had one patient who, after leaving out tomatoes and onions from this test, had relief from the migraines that she'd had for 22 years. So it's sometimes foods that you wouldn't suspect. And of course, I'm not saying that having the migraines was causing fatigue in that particular case, but of course, any long-term suppression of the immune system is going to cause CFSME. So I think there are some obvious overlaps there. Another therapist asks here, does the patient need to be eating the food for the test to be valid? That's a very good question. With gluten, yes. You need to have been eating, and the NHS says this themselves, the equivalent of 2 slices of bread for about a month before you can be sure that you'll actually get an immunoglobulin G reaction that's valid. But if you know that you've either got celiac disease or gluten intolerance before you even begin the test, then it's not worth making that sacrifice and forcing the patient to eat gluten all of that time. So I would just assume that that's part of the picture and not force the patient to. That is not the case with other foods like dairy. If not, how long should avoidance be until the test is invalid? I hope I answered that by saying approximately 4 weeks are needed for testing gluten. Are there any tests for gluten cross-reactors? Not specifically with this test. I know there are other tests that will specifically label foods as cross-reactors to gluten, but with this test, you've got the gluten and the non-gluten grains clearly labeled up, and then you've got specific reactions to each of those. Where does the inspiration for the recipes come from, was another question. Well, actually, the person who was absolutely pivotal in devising this test more than 20 years ago asked whether a group of people could put together the recipes, and it's been growing since then, the particular website that I showed you, and the recipes that are in this particular test tailored to each patient are based on the exclusions, obviously very, very difficult once you've got a lot of different exclusion. When I say exclusions, a lot of different foods that need to be left out. But I can't say that there's a specific inspiration for them. It's foods that are as healthy as possible and as organic as possible. But I mean, none of that is, the organic aspect is not specified, because obviously in some countries that's difficult, in some regions, and you know, some people find it's a bit more expensive to eat organic as well. But I hope that I certainly know that that website that I mentioned to you was highly inspired by some very, very, you know, some people who really devoted much of their lives actually to putting that together. Having recipes is super helpful. Joe says it takes a lot of work and effort out of it for people who aren't feeling great. Thank you. Yes, I do agree. Phil Horse says, you mentioned organic, which I totally agree with. However, if non-organic is part of the diet, could it be that any chemical toxins could cause the result to be an issue? Some food additives are tested for, and with others that are not included, yes, absolutely. Chemical toxins are a huge part of the environmental burden that we have to deal with, and they can cause gut permeability. And there are other ways of testing for them. I absolutely agree. There are lists of foods where it's less important to go for organic than for others, ones with sort of thick skins sometimes. I mean, that's being very simplistic, but there are lists of ones where you really should try and get them organic, and where it's not quite so important if they're not. So we could put those two lists, which change every year, up onto our website. I'll make a note of that. Non-organic and not organically grown foods, unfortunately, are treated with chemicals that can give problems to people as well. E.g. eczema and asthma, yes, absolutely true. And it is worth keeping in mind that glyphosate is used often when a food has stopped growing, just as it's about to be harvested, and the growers are allowed to label their foods up as organic if that's the case. In other words, if they've sort of stopped the growing process and are just about to harvest them, and apparently this allows the fruit, as it were, of the grains, for example, to come out faster. And so testing yourself or your patient for glyphosate sensitivity could be very helpful. Getting a blood sample from a 1-year-old requires a great deal of dedication, Afifa says, from the parents. Children of any age seem particularly freaked out by venipuncture. We call them screamers, even when a pediatric phlebotomist does it. Yes, the advice with this test is actually not to do it from the child until the age of about 1.5, but to do the mother instead, to do the test on the mother, because the child will have acquired antibodies to specific foods, interestingly, from the mother, both in utero and from the breast milk. So that's something that we can always go back to the lab with. If you've got a child of sort of between 1.5 years and 2, and she or he is in the same position as you're describing here, we could ask the lab for their experience of that. A few other questions I'm looking for here. Can you repeat the standard price for the full test, please? Afifa says she had a call, so missed the beginning. I didn't actually mention the prices, and I don't have them all in mind, but if I am clever, I could probably switch to a list of them that I had up just before we began. No, I don't have it up anymore. So what I would suggest is that you go to the website, aonm.org, to the food sensitivity tab, and right at the bottom of that first page, the food sensitivity page, is the order form with all the prices of all the different food tests. And we will soon have the HIT test, the Histamine Intolerance test price up as well, which is not more expensive than getting it from local labs. I know that myself, in fact, possibly a bit cheaper. I'll just have a look at the Q&A as well, where there are some questions. You mentioned that IgG reactions typically happen within 2 to 3 hours. What about reactions to eating within 15 to 30 minutes? Would that be more of a mast cell reaction? Or might that also be an IgG reaction? So, sorry if I said 2 to 3 hours. What I meant was between 3 and 72 hours. Some labs even say between 4 and 72 hours. That's why they're labeled this sort of type 3 delayed reaction. And so a reaction within 15 to 30 minutes could be more of an IgE reaction, I imagine, or, as you say yourself, a mast cell reaction where histamine is being released and, causing sensitivity. And in this case, you're saying that the symptoms are fatigue and malaise. So yes, that would need further investigation, I think. I wouldn't class that as a food, a delayed reaction. How recently does a food need to have been consumed to get an accurate reflection of sensitivity? Interestingly, you don't need to have consumed it recently in order for the sensitivity to come up on this test, apart from in the case of gluten. So that really is the case. There's no sort of specific time frame within which you need to, it can have been years ago. Another question, I'm trying to find a lab test that shows reactions to salicylates, which are in many vegetables, fruit, nuts, herbs, and spices. I'll look into that. I don't know of a test myself directly for salicylates, but maybe there is one. Another question is, would the test be invalid for any foods which have already been removed from the diet? That's not the case, but the exception is gluten-containing foods, as mentioned previously. However, she also asks, would taking hydrocortisone affect the results? And yes, that is the case. There are a few criteria that you need to take into account, which are mentioned on the webpage, which are that you should not have taken steroids for at least 6 weeks before the test. And if you are on steroids, you need to generally, in fact, I think always reduce them very, very gradually. You can't just come off cortisone cold turkey. And so that needs very, very careful discussion with the lab if you have a patient who cannot come off their cortisone at all. The same with immunosuppressants. If they're on an immunotherapy that suppresses the immune system, and also with chemotherapy, it's best not to do the test because you're not going to get reliable results. Again, if your patient is on drugs where you're not quite sure, do just ask, please. I think that's probably all that we have time for today. One last one is if someone was very immune suppressed or they had low immunoglobulins generally, would there still be reliable results? And I think there we'd need to look at the level of immunoglobulins. The IgG, total IgG, is sometimes tested for other purposes anyway. I know that with our PANS-PANDAS cases, we do always suggest testing for total immunoglobulins. And if you see that the IgG is very low, then there are ways of tweaking the results that you get, not just for this test, but for any test reliant on IgG, so that if it's equivocal, you can assume that it's probably on the low end of positive. But that would no doubt need careful discussion with the lab. And for someone that was very immune suppressed from a drug, from a medication, we'd need to discuss that particular medication. But in general, it would not be possible to get a really accurate reading. So lots more, well, I'll say a few more questions. I won't say lots more questions coming in. Thank you so much for the ones that I've had a chance to go through, and we'll keep all of the others as well. Maybe go through them another time. Thank you so much again, everyone, for being there. I'll just mention that there is another webinar coming up quite soon. It's on the 8th of August. That's another Tuesday at 7 o'clock. And that's a fascinating topic with Dr. David Grimes on vitamin D, evolution and understanding. And he'll be covering a lot of aspects of vitamin D that I think, you know, perhaps will be new, even to those who've sort of specialized in that field. And on the 22nd of August, another Tuesday, we'll have Dr. Armin Schwarzbach going over long COVID pathogen reactivation testing and therapeutic options. This is a talk that he gave at the recent Integrative and Personalized Medicine Congress, and we had a lot of requests for that to be repeated because it wasn't recorded. So he'll be giving that again with some further content. So look forward to seeing you all again then. And again, thank you very, very much for being here. Thank you.